Benign paroxysmal positional vertigo is one of the most common causes of vertigo encountered in clinics. It is characterized by sudden onset of dizziness and vertigo, which is specifically triggered by the changes in the head position. For example, rolling over the bed. The average age of onset is 55 years. It is less commonly seen in younger people. Coming to the features, vertigo is triggered by the change in head position as described earlier. Other features are nausea, lasting up to 10 to 20 seconds. Both diagnosis and management is important in benign paroxysmal positional vertigo, D for diagnosis and D for Dix-Hallpike maneuver. On Dix-Hallpike maneuver, patient experiences vertigo and rotatory nystagmus, which can be seen after doing the maneuver on the patients. BPPV has good prognosis. Coming to the management, management involves Epley's maneuver, which is successful in around 80% of the cases. Most of the cases they spontaneously resolve after a few weeks to months. Apart from the maneuver, certain exercises are also taught to the patient. They are termed as vestibular rehabilitation exercises, for example, Brandt-Deroff exercises. Medication has limited role. However, beta histine can be given